My name is Kendall, and I am the communications assistant at the center. And I am usually the one who does these interviews if you haven't tuned into them before. And then this is Tenzin. So, Tenzin, why don't I just have you introduce yourself and kind of what your role at the Center for Spirituality and Healing is?
Certainly. Thank you, Kendall. Yeah. Uh, as Kendall said before, my name is Tenzin. I'm a Tibetan medical physician and a medical anthropologist. I recently started to teach here at the University of Minnesota at Center for Spirituality and Healing. And currently I'm teaching class focused on integrative health with Tibetan medicine as one of the main health modalities. So I'm really grateful to be here. Thank you.
Yeah. So today we're going to be talking obviously about Tibetan medicine, which is something we have talked about in our live videos before. If any of you guys have seen our Facebook lives, we sat down with Mim Cameron, who Tenzin and her work together a lot on a lot of different things. So if you missed that, make sure to go check that out on our Facebook page. But yeah, so today we're gonna be covering Tibetan medicine with more of like through the lens of COVID-19, which is obviously a really big thing that's going on in our world right now. Probably like the thing going on in the world right now. So I think just with that, like COVID's become like a serious health issue in the past months, and there's a lot of unprecedented suffering and disruption, and people are trying to like understand this new disease. And so could you maybe tell me how Tibetan medicine might interpret a disease like this?
Certainly, Kendall. Yeah. Thank you for this question because I've been asked this same question quite often in last couple of weeks. And from Tibetan medicine perspective, certainly the underlying understanding of disease like this, COVID-19, which has really spread all across the world, and it has such a tremendous amount of impact in terms of health and fatality, both morbidity and mortality. So underlying understanding would be same, but in Tibetan medicine, when we look at a disease of this nature, we always try to look at two different levels. So one level is really trying to understand the source of the disease, where actually it come from, right? And that's what all the scientists and clinicians are trying to understand. The second level is really the cause and condition we generally are obviously understand, and it's very obvious out there. So the first level is really trying to understand that what's the primordial source of this disease like COVID-19. And in Tibetan medicine, our focus is very much on our own individual behavior. And so that's why in the text, the traditional Tibetan medical text called Gyushi, we would say that it's really dependent upon the contaminated or degenerated human moral behavior, where due to greed and attachment, people engage in behaviors that is not respectful of our environment, our nature, and therefore illness of such nature would come. And those are almost like a kind of forecast that has been made thousands of years ago. So that is important, but at the same time, we need to understand what are some of those causes and conditions that we could relate to in our day-to-day life. And so that brings it down to the next level, which in Tibetan medicine says the secondary cause or the obvious causes that we could see is really the disruption that has been done to the environment itself. And in Tibetan medicine, we look at the elemental nature. So any kind of earth or water or air or space elements which are being impacted by our own contaminated moral behavior. So that's why there's lots of emphasis on how actually disruption this element could make environment so vulnerable, and therefore since we are all of us are very much dependent on our environment, therefore it would make us vulnerable. The conditions that we try to attach to that is then our diet and behavior. And so there are certain diet which we usually are able to find in our immediate environment, but there are certain other diets which we are not supposed to consume, and those are some of the diets which can really have a direct impact on what kind of things that we are putting in our body, including some of the wild animals that we are not supposed to ingest. And so those could be a very immediate condition that we could be exposed to. And then the behavior is really very much about if we are engaging in certain behavior that could put pressure on our psychological state of being, that certainly makes us more vulnerable. So that's why both at these different levels of going to the very primordial or primary cause and coming down more narrower to our immediate behavior, and how those things can actually lead to a condition like this.
Yeah. So I guess kind of not related to that, I guess, in a sense. The next question I kind of have is just in terms of like testing. That's one of the big problems is that there's not a lot of tests available for COVID, obviously, as a lot of us know. And for people who might be experiencing symptoms related to COVID, but they can't get tested, is there like a way that Tibetan medicine could help in a situation like that?
This is really interesting in terms of, again, so many people now, particularly most of the communication that I've been having are people in places like in New York, where the healthcare providers as well as other frontliners are inundated with all those different exposures, including people coming up with symptoms, but they are not necessarily eligible to get tested. And so they don't really know what to do. And again, what I try to tell these people are certainly doing a legitimate COVID test should not be substituted by any of the things that we are talking or I'm trying to advise them to do. But sometimes there are situations where you might show certain symptoms, but then you are self-isolated at your place and you don't have that access to go out there right there and get tested. And so in Tibetan medicine, in terms of diagnosing any kind of physical imbalances or mental imbalances, we usually always rely on our sensory organs. So in Tibetan medicine is really about using our tactile sensory, which is by checking our pulse. And it's very profound. It has to be understood very profoundly, and then therefore how it could be employed when we make a diagnosis. But in situations like this, we can certainly complement that in how we can make things a little bit more bearable. So when we talk about the tactile, we do the pulse reading. One thing I always tell them is feel your radial artery pulse. So if someone is doing like this, so radial artery is right here, an inch below our wrist. And so yeah, exactly. And then what you can do is you need to put your 3 fingers, right? The first, the middle, and the ring finger, the index, middle, and the ring, and then place it firmly on your radial artery, and then see what kind of a rhythm or the sensation that you are getting. And usually with any kind of infection, and especially like a COVID infection, where it's sustained infection that's happening in your body, where it actually over-exacerbate or over-accelerate our organ function, particularly related with our lungs. So you could feel that the rhythm or the sensation of a pulse could be really fast, firm, and strong. And sometimes people usually would have a pretty weak pulse and they don't necessarily feel it at all usually, but then during those times you might experience that, oh, it's much more firmer and faster and stronger than that. The other thing that one can do is in Tibetan medicine, we use urine sample a lot in terms of getting like a granular detail of what's happening in the body. And so it's really actually quite simple and easy to do in this situation. Certainly not to say that people would spend their whole life to understand how you can make a urine diagnosis based on urine analysis. But here what you can do is you can have your first urine sample in the morning and catch it in a clay container, and then look at it. And usually with someone with this kind of a COVID infection, you could see that it's pretty dark yellowish, dense with sediments, and then it would have an intense smell. And then if you have a small stick or a chopstick or something that you can stir the urine, it would right away produce immense amount of bubbles, and those bubbles would be tiny little bubbles. It's not really huge or big, tiny little bubbles. Sometimes if you're mentally pretty stressed out, then lots of bubbles, but in the middle of all those small bubbles, you might see some big bubbles, and which would imply that your state of mind has also been quite stressed out. And so that's why these are something that you can see, and then you can look at your tongue. And so usually with people with any level of sustained infection or fever in the body, you would have a reddish, dry tongue. And suddenly that's why certain number of COVID patients or with such suspicion of COVID illness, they would report losing their sense of taste and also a smell, they would say. But that's how you, and I've been helping some of the people who are at their place and they have all the symptoms, and they would have a FaceTime with the doctors, but they don't have the access to go out and do the test. And so I would tell them to do those things, and it certainly helps them to get a certain understanding. And so that's how someone can really use tools like this at their home in order to make things a little bit more bearable.
Yeah, cool. So, and also just a reminder to our audience members quickly that if you have any questions, you can also comment those below, and we can cover those at the end, just because I know a couple of people joined us after I said that at the beginning. So the next question I have is just kind of like, so obviously like sheltering in place has been pretty effective in terms of like containing the spread of COVID, and that's like the way that the US is kind of tackling that. But there's also a lot of people who don't have that luxury of staying at home to protect themselves, and especially a lot of our people who might be fans of the center are healthcare workers who are right in the front line of the virus on a daily basis, and so they can't totally stay protected like that. And I guess like from kind of your Tibetan medicine perspective, how can those people protect themselves while also saving other lives?
Absolutely. Yeah. And we have been seeing scores of videos now in last few weeks, doctors and nurses. The other day I saw a short video clips of a physician in New York where their typical shift runs for almost more than 12 hours. So they would start early in the morning until late in the night or in the evening. They will be there in the hospital, and how actually they are not only witnessing scores of people dying, but also the way they are dying. And yet at the same time, they also have to think about themselves, their family members, and other community members. And I think this is such a critical time for us to look at every possible ways to not only for us to support them, but also for them to know what they can do. And this is such a key question in terms of how we can do that. As far as from Tibetan medicine perspective, what I've been, again, trying to, when I last few calls that I received, most of them were nurses. I haven't really spoken to any particular physicians as of now. But what I've been trying to tell them is really, one key thing is really now, I mean, unfortunately, our healthcare providers, not all of them have a good PPE or personal protective equipment as much as they should have. But over the last few days, things fortunately have been changing positively a little bit, and people are getting more PPE resource. But that's a physical kind of a protection or immunity that one can try to provide to themselves. But the other thing is really a psychological protection. And I think which is really key. And I think from a medical system like Tibetan medicine, that's such a focus of our intervention. And I think one of the things that we could do is bringing in both the philosophical aspects and the interventional aspect. The philosophical thing is really how you actually can make this little bit of shift in perspective. And all those videos that we have been getting exposed to is really like how they start the day with such a positive attitude. But by the end of the day, and especially when they end the shift, things really get pretty gloomy, and they really start to feel like, okay, can I come back tomorrow and get back to my work and help people who are dying one after another. And I think that's way a certain thought perspective, like coming from Tibetan medicine and Buddhist, could be really helpful, because again, it's really rejuvenating yourself and recharging yourself by the end of the day. And that's really key. And what we can do from Tibetan medicine, we usually say it's really to know that the connection that we develop when we're going into the hospital is really critical, because you are there 100%. You are with your patients, with your the patient's family members or your colleagues. But the important thing is once they are done, it's really important to not be too attached to what they have seen, what they have experienced in the hospital setting, and to really kind of, if I may use the term like withdraw, it might have a little bit of negative connotation, but really to kind of let yourself out of that a bit, and that could really help to find that space to rejuvenate. And then whatever, most of the doctors or healthcare providers would have their own routine or a ritual, if you will, and they can adopt certain new, I mean, just like we're talking about COVID, it's a novel coronavirus, but we can adopt a certain new routine or novel routine in our behavior. And so, for instance, like most of these physicians, what you can really do is try to retrospectively think about how you have been feeling early in the morning, and how much you have done through the course of the day, and how much that emphasizes the importance of interconnectedness and how things are so interconnected. And as much as you have felt earlier this morning, you are the same person, but things might have really been more difficult by the end of the day, and you have almost feel like you're drained. And I think that switch in introspecting on your feeling, how you have been feeling and what you have experienced and how you want to prepare for next day, that's a critical moment, I think, for most of the healthcare providers. And I think I try to talk to them in that respect, and they have shared with me that it really helps them. And so I think that's how we can actually really be looking at both the physical and the psychological immunity that we can develop, and then get ready for the next shift or the next day.
Yeah. So, and then another thing I think too, with when it comes to social distancing is, I know especially like, so a lot of like older, like adult children, their parents are older, and so they can't, like, they really shouldn't maybe be together. I know that some of my friends have been unable to like go visit their parents just because they're older and they don't want to expose them, and like they want to continue to follow those social distancing guidelines. And so like, I guess like in terms of like that, like older people being so much more vulnerable to like fatal outcomes, or like just worse, at least worse, like manifestations of the virus, what would like Tibetan medicine's perspective on that kind of be, if that makes sense?
Yeah, absolutely. And this, like, especially for someone like me, it really makes so much sense, because most of the people who have actually reached out to me, some of my friends or Tibetans who I have never talked to them before, but they would reach out to me with a very similar issue like this, because like in the States, many Tibetan immigrants, they have a multi-generational family members living together. And there must be a lot of other immigrant community or family members with that kind of family structure. And one of the main complaints or main issues that they are facing is really not having that, not able to have that smooth communication with their parents or vice versa. And I always tell them that if we are coming from Tibetan medicine perspective, we usually say that when people get a little older, when they get into 70s or above that, they're in Tibetan medicine, what we call is a lung. So lung, it could be literally translated as a wind, but lung means our nervous system or the neural pathway. And for elderly people in Tibetan medicine, we say that their characteristic of lung or the nervous system get heightened. It becomes really more sensitive. And so therefore, in general, their response or reaction to external stimuli is way more instantaneous and more deceptive. And so therefore, in a situation like this, where COVID-19 has almost become an existential fear or phenomenon for all of us, our older population suddenly would react or respond to this way different than other people of other age. And so that's why they might experience or react in a very particular manner, especially more in terms of being anxious, being scared, being fearful. And I think it's so really important for their children or other family members to realize that, so that, okay, it's not just that they have been too fussy and too, complaining, but it's just that it's the way the neurobiological system is working. And also can work from the other side too, that for older population or the older people, to know that it's not due to the external stimuli that they are really more anxious or scared. It's just that biologically and physiologically, the system has become much more sensitive. And so having that understanding would help both the older population or the older people as well as their caretakers or family members to know that there is something else happening other than just reacting to the external situation. And I think I've been trying to convey that message to my friends or other people who will reach out to me, and it certainly helps them because now there is this other things to factor in. And so they will, okay, first, how you can actually calm down your very heightened neural pathway or a nervous system. And once you're able to put that in or factor in, it helps to communicate and have a better communication. And I think that's key.
Yeah. And so I know that you have kind of been helping people via like teleconsultation and throughout all of this. And so what kind of advice have you been offering to people who are infected with COVID-19 or just those who might be in more vulnerable situations?
Yeah, and I think, Kendall, this tie up with one of the questions that we touch upon in terms of how healthcare providers or people on front line can protect themselves. Yeah. Same goes with people who are more vulnerable, even though they are sheltered at their place, like older folks or people with immunocompromised situation who have underlying conditions. And also people in general who are now experiencing this existential fear, not only of COVID, but also toward their own mortality. Because now the COVID is almost synonymously used with fatality, which is not true, because like the percentage at which the fatality rate with COVID is much lower than sometimes people would think in terms of what they see on media. But what I've been really telling them is like we could have two different conditions here. One is asymptomatic. People might already been infected and they don't have any symptoms, or people who are pre-symptomatic and they are about to show the symptoms, and they will reach out and say that, okay, I'm having a little bit of fever. I feel like I can't really smell anything. So what's happening? And so the first thing is really, please don't panic or don't be scared. And that's so critical because, again, not to discount the gravity of the situation, but it's so critical to know that what I would ask them what you would do if you have two deadlines next day and you feel like you are coming down with a cold. What you do? And one most common thing that we would do is we will make sure that our body doesn't really get susceptible to getting a full-fledged cold, right? And so what we do is you stay warm, take care of yourself, uh, 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 have some comforting food, have chicken soup, have lots and lots of hot water with ginger or lemon. Those are the things, and exactly the same thing you should do. And in addition to that, what you can do is really make sure you are in a place where you are not only yourself is safe and kind of expedite your recovery, but also other people if you are with any other people at your place, they are safe too. And so that's and without panicking or without being fearful, you engage in that thing. And now the other thing that I would really tell them is, see, the thing is, you might not even have COVID at all. It's just that you come up with these particular presentations and which might very easily be tied up with COVID. So how you can deal with that. And so in Tibetan medicine, usually we always say that the first medicine, or again, if I may use the term primordial medicine or intervention, is hot water. And so, like, if any one of you would go to any Tibetan's home, if you don't tell them not to, if you don't ask them for any specific beverage, they will most probably feed you a hot water. And so hot water in this situation seems to be really helpful because when we talk about any kind of illness or infectious disease like COVID, in Tibetan medicine, we usually make a distinction between three different ways of getting into our body and causing problem. We usually say Nacham, Decham, Yacham, Decham, and Locham. Now, those are Tibetan words, but Yacham means when the virus would have a way more impact on our sinus. Now, Decham is the throat. When the virus would infect your throat and you start having sore throat. Now, the third one is the infection in lungs. And with COVID, that's happening. And so that's how we try to tell them that, okay, now that the COVID is much heavier than most of his other type of virus. And so you need to do, what you need to understand is it will get on your lungs. So how you can help and support your lungs if you feel like that's happening. And so circular breathing, being very careful with your chest to keep it warm, but engage in breathing or engaging meditation via which you are supporting your lungs. And then reducing any level of stress on your mind, because that would have a direct impact on your breathing. So those things try to tell them, because again, reducing the level of fear or anxiety, trying to help them to get facts right. And the third thing is how you can support your body, both physically and mentally. And so those things really comes handy together.
Yeah, cool. Well, yeah, thank you so much for that. That's, yeah, very helpful. And I think, I don't know if you want to like say how people maybe could get in touch if they want anything. We can like leave that in a comment later or in post later. But yeah, I don't know.
Yeah, and I think I mean, people can certainly think on the center's Instagram page, if they leave a question, Kendall, you can forward that to me, and I'll be more than happy to respond to any of those questions. And if someone want to talk about things in privacy, and there are certain issues that they are not able to deal with by talking to other people or or the primary doctors, I'll be happy to. Kendall, you can provide my email address, and I'll be really happy to respond to any of those people.
Cool. Yeah, awesome. So yeah, if you we can totally do that. You can just DM our Instagram or leave a comment or something, and we'll get in touch with you. But cool. Well, thank you so much, Tenzin. And I don't know, did you have anything else you wanted to add before I wrap up with a couple housekeeping things?
Just quick point here is really, I think it's so important for for all of us to use this to not only to kind of introspect on our life, but reevaluate our own moral behavior. I think which is really key here, because getting ready for getting prepared enough for next endemic or pandemic breakout is really important. But more than that, the important thing is to prevent any future outbreak. And the best way, yet the easiest way for us to do is to discipline our own behavior, particularly our moral, ethical behavior. And I think that's in our hand. We don't have to go out anywhere and spend money. It's really very much in our hand. And I think that's really key in terms of preventing any future outbreak.
Yeah. Yeah. Thanks. And yeah, and just before we end completely, just know that to our audience members, know that our website, csh.umn.edu, has a lot of resources for dealing with kind of COVID anxiety and all that kind of stuff. And you can find that it's linked directly on our homepage. It's the first thing you see. And yeah, so make sure to check all those resources out. Also, just know, so you know, we also next week have a well-being series lecture with Celeste Headley, who will be talking about 10 ways to have better conversations. And that's going to be via Zoom, of course. So you can find more information about that on our website. It's also linked on our homepage, and we've been posting about it on social a lot too. You can definitely find the link for tickets just on our Instagram posts. And yeah, and those are pretty much big things we have going on. We have a lot of free webinars coming up, and we just keep adding more. So make sure to keep an eye on those, and we'll post about those on our social too. But yeah, so thanks so much for joining us today. Thank you, Tenzin, for taking the time for this.
Thanks, Kendall, for doing this. Thank you.
Thanks. Bye.
Yeah. Bye.